our sector of traditional healthcare delivery, especially when you must go in, is broken. But the digital part's doing pretty well, I think. It's just that not everything can be done digital.
Welcome to Unstoppable Brain. I'm Dr. Kyra, and we're here to translate neuroscience into behavior change and the life you want. Today, we welcome Dr. Joseph Kvedar, professor of dermatology at Harvard Medical School, president of the American Telemedicine Association, and author of two books, The New Mobile Age and The Internet of Healthy Things. Dr. Kvedar is the best tour guide for just the business of healthcare, the trajectory of healthcare over the years. He has been at the advent from the very beginning of digitization of health. And why do we have to know this? We have to know this because if anything's going to stop us in our tracks, it's going to be our physical or mental health. We're all heading the same direction. We're biological beings. And as we go and advocate for ourselves in healthcare, we have to know what's under the hood. And Dr. Gavadar is very helpful in showing us the wisdom, the patterns, the future even, and ends on a prediction that I think is really poignant. Welcome to Unstoppable Brain, Dr. Kvedar.
Hello, and so great to be with you, Kyra.
So glad you're here. I have been wanting to talk to you ever since starting this podcast because you are a central figure in digital health. You saw it coming along, on the horizon. You saw Internet of Things way before it was a thing, and you wrote a book on it, and you had a connected health conference of that theme of seeing that we were going from paper to digital. And my first question to you is, honestly, how did that go exactly as you thought? And then how did it go wayward? And then let's get into the juice of the waywardness part of it.
Sure. I mean, it was a bit lonely at times in the early days. I started this journey, and I tell people I took a wrong turn in front of the Mass General Hospital and wound up in this land of because at the time it was people really thought I'd gone off the deep end. This was in the early 90s. No, they really did. I had a standard type of existence at the Mass General. I was doing basic science research, and all of a sudden I was in this world. So it was a little bit lonely at first, and although I'm comfortable now saying that I did come up with a few things and predict them, and they have come true, and we can talk more about that. The book that you mentioned in particular, I've been dissecting over the last year or so to see what we did get right and didn't. I will say I was uniformly way ahead in my optimism of where the market would take us. I read something the other day, and I apologize to our listeners. I can't remember exactly what it was, but I thought, oh, yeah, that was something we were working on in 2010, and now it's just become a thing. That doesn't mean we were so smart because we we were ahead of the market, but we were probably too far ahead a lot of the time. And it's hard to grow an enterprise when you're that far ahead. When you're in the actual marketplace with stuff like that, your company fails and you move on to something else. So, because I was in academia, we could do a lot of that work and we had good support to do that kind of work. What went well, I'd say, the book you referred to, and I often mention this opening chapter, which was at the time pure fantasy, but I had, it was about a, a, a digital helper or guardian called Sam who, knew everything about me because Sam had access to wearables data, my mobile phone purchasing data, all of my location data, all those things that were at the time just becoming a thing where you could actually do location-based services. Now, of course, it's a ho-hum, and, that was why we call it the Internet of Healthy Things, because that was the Internet of Things as it was unfolding, and Sam would say things to me like, again, in this fantasy, I'd go out at lunch and he'd say, "Gee, it looks like you're walking towards the cookie shop. Maybe you should take a walk around the block because you need to get some more steps." Or, "Hey, there's an ad down the street at Boston, Sports Center for, swim club. I know you like to swim." So, we made that up, and that has come true. Those products, as you know, exist in the market, and some are pretty special. In the last maybe 3 or 4 years with I mentioned a few firms. I don't feel like I have such a grasp on the market that I can get everybody and everything. But for instance, Aura has really caught fire because they have that. On some people find it wonderful. My daughter's an Aura devotee. My wife has one as well, and they sort of compare all their stats. Um, and it does. It tells them, oh, by the way, you should be doing this. Maybe you should go to bed earlier, etc. Where we've gone awry though is when people see dollar signs, they sort of shortcut things and they're out there in the marketplace with stuff that doesn't really work and that this is healthcare. That's the thing. I was talking to someone earlier today about uh break, move fast and break things. And why don't that he asked me, why don't we do that in healthcare? I said, well, it's pretty simple. It's we're talking about your health or your life if we want to be dramatic.
Yeah.
Healthcare
Right.
on the one hand is too plodding for sure, but we certainly don't want to move fast and break things. So we have to find something in the middle. And right now, there's so many firms on the market that are, um, and once they get venture investor dollars, then it's all about getting an exit as quick as possible in your 10-year horizon. But you want to be in the middle of that. So how long's the fund been on, et cetera, et cetera. And it starts to blur with, well, what are we actually trying to do to help people get healthier?
It's really become performative for those dollars too, because it's become completely and wholly, especially when interest rates were low and money was free. You had
Mm,
a lot of proliferation of innovation
yeah.
on the backs of the largest generation ever, the boomers, who were gainfully employed. And as they've retired, interest rates go up, money's not free anymore, and there is this infrastructure now in place for startup culture that is very much this shortcut thing. I would say that, move fast and break things, which was, Facebook's motto back in the day. you know, Arguably, there's no policing of that consequence. You have teen suicide, you have, young people hurting themselves, young people being disempowered by what's going on in those social media algorithms and environments. And that's all fallout from this kind of carelessness around people's lives. And as you say, medicine is more responsible than that. Medicine, we take oaths, we take vows to do no harm. And even though there will always be snake oil salesmen, I think, grifters forever in healthcare and in health and wellness, it really does have some level of temperness, I want to say, to how crazy and, careless and reckless the digital health world can get. Would you say that's a fair summary of that?
I would, but it does take, on the flip side, it does take forever, whatever, 17 or 20 years to get a pharmaceutical to market, and digital health moves a little faster than that, but it's like I said, we have the FDA, so we have a heavy regulatory presence. We have most things should have some legitimate scientific basis. That's another hat that I wear. I'm editor at a journal. Um, I have to say though, whether this is something we want to dive into or not, but with AI companies, many of them don't do clinical research on their products and they just throw them out there, which is kind of scary. They're taking advantage of what I believe is and I think it's Arthur C. Clarke. I won't quote him properly, but it's any new technology is indistinguishable from magic. And AI, especially generative AI, is particularly magical. But of course, it's not magic. It's just statistics, and we have to keep reminding ourselves of that it isn't a person. It's a computer, and it behaves only as well as a computer behave based on the data that it sees.
Yeah, I don't know how people get fooled by AI, or I don't know which AI they're talking to, because the ones I'm using, like I'll give you an example. Last night, I was writing some language to speak to clinicians because I have this idea of like clinicians, the walls are closing in terms of private practices. There's all these pushes, all this third-party apps, that kind of thing, that we'll get into that, but, and the AI was drafting language that was kind of saying the quiet part out loud, because I was saying, "This is what they're facing," and then it was saying, "So this is what you're facing." Like, "No, no, no, AI." Like, I don't know who I don't know who is dealing with, maybe they have better AI agents than I do, because the ones I deal with, I'm constantly, like, doing this, like, just,
Yeah,
oh my gosh, don't, like, just EQ fail all the time, and so I don't know how we get out of that, because it is ultimately based on, autocomplete. It's a very sophisticated autocomplete, and I don't I'm more and more becoming disillusioned with this idea that there's thinking there, as
it's
opposed to patterning, as opposed
amazing
to
though.
yeah,
Patterning is very sophisticated in many cases, and there are certain tasks, one that comes to mind because 'cause we're chatting here, but summarizing a meeting like this, the computer's pretty good at that, pulling out this if we were actually having a meeting where we're gonna have next steps and tasks, it would summarize that pretty well.
that's true, that's true.
Um, but, and again, as an editor, I see, sadly, people now, of course, are writing manuscripts using large language models, and half of their references are hallucinated and so forth. It's
And
gotten
they
bad.
don't check them. They don't check them, because I check all
I
my
mean,
references.
look, if you were gonna write a paper using AI, how careful would you be? It's a different mindset.
That's true. I have, become I really do appreciate the ability to do a very quick literature review. I'll give you an example. I was doing a literature review on autism and habenula, because I have just run into a bunch of parents recently who have autistic children, and who also have gone to my talks on the habenula, which is, for those of you who are new to this, it is the area of the brain that, activates when we fail at something or get disappointed at something, and then it down regulates our motivation so that we quit trying, and controls dopamine, serotonin, and drives depression, anxiety, addictions, all that kind of stuff. And we'll get into, like, Joe's trend spotting on the habenula in a minute here, but, the the lit review, was really quite helpful to kind of condense the standard of care and what is known currently about ASD, and then autism spectrum disorder, and also layering on top of that the neuroscience of the habenula and how it might be playing. So it wasn't just rote repeating back to me, but it was actually speculating
Synthesizing.
mechanisms of
Yeah,
action,
yeah.
which to your point, was very sophisticated. So I do think that we will see, how are these being used. What are you seeing in your role with your hat on as the journal editor? What are you seeing generally besides these, like, shoddy manuscripts that, people don't do their homework on, because 'cause they're moving too fast and breaking things maybe? What do you see as the kind of advent, because I do think that you have a real vision, a third eye into the future oftentimes, and where are you seeing all this go?
Well, I'm continually, and these days, the journal has grown over the last year. We're now 300% more volume of submissions than we were a year ago. It's just that digital health is having a moment, and I'm so happy to be able to participate. So that's one thing. It is, I guess, maybe not too surprising, but on the other hand, pick your clinical problem and someone's applying machine learning to it and developing something interesting. And
Mhm.
I screen those papers and hand them off to people smarter than me to actually do the editorial work to make sure that they're sound and send them to review and so forth. But it really is a moment for this technology, generative or just machine learning, either one. So that's interesting. The other thing, and I alluded to this earlier, though, is just how far wearables have come and how
Yeah.
fast they're changing in a very positive way, whether it be for actual clinical management, or for wellness, or something in between the two. And that's again kind of a dream of mine because I was interested in wearables, 15 years ago, and people thought I was kind of a nut because I had 4 or 5 things on my wrist at the time, checking them all out and whatnot. So it's great to see that happening, and they really do. What's the punchline with wearables is that it's a as you know, because we've talked about this many times, it's a continuous picture of your health as opposed to that 5-minute slice you get when you go to the doctor.
Yeah.
And there's so much we can learn from that. We're just starting to scratch the surface.
Yeah, I mean, it opens up patterns of how we live, given that we spend even the sickest among us spend, less than 1% of our lives in front of a clinician, right? And fills in the gaps and also helps us to deal with the fallibility of our brain, which is that we really only have 5 to 9 things that we can hold in our short-term memory at a time categorically, and then, we're done. This is why clinicians, when they're trying to help patients say, eat healthy, exercise 3 times a week, 30 minutes a day, whatever they always say in my, conversations with them that they have a spiel. They have a spiel, which means that they just press play and they tell every single patient pretty much the same thing with some maybe modification in the moment for if they have diabetes or hypertension. But, that is not where we need to be anymore. We need to be in this very personalized thing. Now, I'm going to argue with that now. I think that personalized medicine has gone too far. We have the Brian Johnsons of the world who are like quantifying everything and, getting all kind, getting his son's blood transfused as a blood boy into his own body and things like that. I think there's a wackadoo, segment kind of happening. And certainly in health innovation, like you said, you were considered a wackadoo back in the 90s, because you were early to the game. What do you think the utility of the kind of extremism of that will offer to the mainstream to move things forward? Because that's like 2 standard deviations away from where everybody else is gonna do and what optimization other people are gonna do.
It's a really interesting question. I have to admit that the what you just that general area that you described as the wackadoo, I'll quote you on that. That I just it's hard for me to take it seriously. And I say that with somewhat sheepishly because as you point out, I was at a point where people didn't take me seriously at one point. So and lately, of course, everything's about longevity and there's so much about, all these things to whether it be potions or what have you. And so it's very hard to sift through that. Most of it doesn't have a scientific background, or if it does have some kind of underpinning that's scientific, it's a little bit shoddy. Uh, so, but like anything else, you now have, I don't know what the percentage is, but I still practice 2 days a week, and most of my patients are my age or older. I'm going to be 70 next year. And almost all of them have a Fitbit or a Apple Watch or something, right? We're closing the circles. All those things now are pretty mainstream. So I guess it's like anything else where you have the far out, maybe some of those things that are far out, like I have no idea about transfusing your kid's blood. I won't, this is not medical advice, but maybe someday we'll learn something from that. I don't know. I mean, when you think about some of the technologies that are used now in, for instance, cancer care, whether it be CRISPR or some of the immune uh, therapies, those didn't exist 20 years ago. They were figments in someone's imagination. So the sad part, I think, is when you get someone who is that they're using their wackadoo status to promote themselves on social media.
Right.
That throws the whole thing off. It could
Right.
be interesting work, but you just look at it, roll your eyes because like, the person's just trying to get more followers.
That is a really important distinction because if we take you in the 90s and you had this vision, you had this sense, spidey sense, if you will, that digital health was going to go somewhere, it was going to become something, right? And you've stayed true to that. You had some premise for that. and it was lonely, right? It wasn't this kind of cult following, intention on your part, and I've found you to be always pretty understated. You're not a, really hyperbolic person. You're not, overly, fantastical about things, and yet you have a sense of innovation that is grounded and is real and is predictive in a way that when you take it to this sort of, circus of social media and somebody has a profit motive, you didn't have a profit motive. It wasn't like
No, I
you were
really
trying to convince your colleagues and you had your little, wares over here to pitch them, right? Like you kind of were still taking the perspective of, I want to put together a digital health lab. You had a lab where you were inventing things. You had staff, you had people, and you were all kind of working on this problem together, but it wasn't this marketing, heavy marketing play, right?
no, it's I think back sometimes about what drove my thinking in those days, and not to make it necessarily about that, but it is interesting. There are 2 or 3 things that stand out. I'll just share one now. We could talk about the others as well, but is the idea that when you have that kind of perspective, it does make you feel kinda special that you can see that stuff, and the people around you can't.
Mm,
Um, I still do work with the American Telemedicine Association, and I've been there since practically the beginning. I think I joined it 2 years into its existence, and
wow.
at that time, I always tell people it's really a bunch of misfits because we were all people who nobody believed could get anything done, and the tech was sorely lacking. I mean, just not to even go in that direction. So, there is that time when you're I don't know whether you're the lone voice howling in the wilderness or the lunatic fringe, but it feels like that's okay because I know that this stuff is and you're really confident about it. Again, it was just I always thought it was about gonna be about 5 years, and it took 30, so that's where I really was amiss.
I've heard that over and over again from innovators, and I think it's really important as we think about, the times we live in right now and the sort of asymptotic, accelerant change that we are living through. And we still, though, like you said, with telemedicine, I was running the telemedicine strategy at Aetna, in 2009, 2010. Here we are 16, 17 years later, right on time. Now it shows up as kind of
Main Street.
the mainstream, and I couldn't even get a Kaiser appointment in person if I wanted to, like, I would have to wait months and months. They have a whole way that the workflow has been redesigned around it, right?
Mhm.
And so we're living in a time when we are, as patients, if I just put my patient hat on, we
Sure.
have to be so educated and so adept at using these new tools and being aware of all these things and, oh my gosh, like all these trends on social media. We got to figure out like which ones are junk and BS and which ones are real and all that kind of stuff. And I find that there's a lot of work
Mhm.
associated with just being a patient these days
Yeah.
and having to navigate the systems. And do you think that's kind of a subtle form of not intentional of rationing or Darwinism where, it creates this spread of those who can and those who cannot advocate for themselves or know about the healthcare system or have a family member, a nurse in the family or whatever to help them navigate that? Like, has digital health caused more complexity than the average normal person can handle and therefore shut them out of care that they deserve, is my question.
Well, I'll focus on the healthcare provider part. For now, let's not talk about Roe and Hims and Fitbits and all that stuff because that's, I think, it's slightly different. Um, my perhaps favorite example of what you just said, uh, I used to give my email to patients, and then now we have, of course, a secure patient portal, which is much, much better for all kinds of reasons. So I tell them, "Are you using our Partners Patient Gateway, that's what we call it. And, again, some not many, but some of the folks that are in their 80s and so don't. And I tell every single patient, if you need me, because it's 9 months right now to get an appointment with me. If you need me, send me a gateway message and I'll fit you in, and I'm always overbooked and I fit people in all the time. But if you can't navigate that system, you call and you get the schedulers and it's a 9-month wait. So
Mhm.
that's an example of what you said. On the other hand, both the electronic record and the patient portal have made it, for the vast majority of people, so much better. So it reminds me of the days when we used to talk about, if you and I both went through this, of the adoption of the smartphone, right? In the beginning, it was haves and have-nots, and then it became 50 or 70 or 80% at one point, mobile phone adoption. Now nobody has a landline, almost nobody does. So to 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 put that in perspective, yes, there are a few people, most of them older, who don't use the computer, but it's pretty rare now, and almost everyone will say to me, "Yes, I'm on that, and I love that app," and because they get all the results there, and they can, again, send me a message directly to me, bypass the staff. So, kind of a long-winded answer, but I see both sides of it.
Yeah. So then what has gone wrong? Like, let's take the other side of the equation. What has gone wrong with digital health, um, from your original predictions, your original optimism, I would say, back when it was nascent and even when you joined ATA and
Hmm.
various things like that, like, what are you disappointed in
Well,
terms of where the
I guess I'll
organization.
go back as far as you mentioned the book earlier, Internet of Healthy Things, which we published in 2015, wrote largely in 2014. So that's now 12 years ago. Um, and a big theme in that book, and then I did another book a couple years later called The New Mobile Age, which was more about aging, longevity, and tech. But the big one of the big themes of the Internet of Healthy Things was how we needed to move to a system where we aren't paying healthcare providers for every little thing they do. What would be called volume-based reimbursement, right? To one where you're being paid for keeping people healthier and generally doing more pop health and so forth, which we would in the industry call value-based. We really, I would say, have failed on that miserably. Whether that's because it's a $3 trillion healthcare is a three, whatever it is now longer, $3 trillion juggernaut, and the old adage that every dollar saved is a dollar of someone's income lost, so it's impossible to change. I'm not sure.
Mhm.
I was on the phone earlier today with a company out of France that has this uh, tool for allowing patients to essentially monitor symptoms during um, oncology stints or episodes of care, which, of course, for cancer can be years. And they're having wild success in Europe because it's kind of one payer and everyone's sort of trying to save money. Everyone's rallying around that cause for the most part. And in
Mhm.
the States here, it's miserable. It's still, as you know, costs keep going up. Uh, I keep, doing more and more fee-based work because that's how I'm paid.
Mhm.
Um, and I really thought that the digital tools would help us with that. And it got to the point where I even caved and I joined the efforts by the AMA to create codes for reimbursement for these things because it was going nowhere without it. So I even caved on that vision myself. That was in 2017. So I'd say that's the biggest failure is just that we can't get out of our own way when it comes to how we finance healthcare in this country.
And it's really poignant to me that you who have tried every which way or have, um, worked towards that world of value-based care, is saying these days that, you know, not that there's no way to do it, but that you can't see a way to do it because, again, going back to Even just the thing you were talking about with the French company, you're always on the edge, even though you're very understated about everything, you're always on the edge of what is coming and what is next, and the fact that you have not figured that out is really daunting, frankly, for all of us. So, my question around access to care, around patient care, let's go to the retail side of things. So, hims and hers, Roe, the rise of, telemedicine slash PBM. But for those of you who don't know what that is, pharmacy benefits manager. And what that is a handshake that never used to exist before between clinicians who prescribe medications
Mhm.
and making money off those medications. That used to be, 2, and now you're mixing the peanut butter with the chocolate, by, Amazon, Pharmacy announced with their acquisition, their wholly owned subsidiary of One Medical, that they're gonna be I'll call it self-dealing, maybe that's too harsh or unfair, but I feel like we as patients have to keep aware of these things because not only is the onus on us and complexity is coming our way and we're having to discern all these things, but there's big sort of conglomerates happening, aren't there? Where there's areas of healthcare that are breeding with other areas of healthcare that have never had children before. But the metaphor was just rolling out of my mouth. Where's this going? Yeah, so maybe comment on what does that do to patient care? What does that do to typical allopathic medicine that is, like you said, fee for service, that is, predominantly in person or used to be in person, but now is kind of can they compete on the telemedicine side with these, kind of doc in a app kind of situations? Or do you see that that's going to become the primary form factor for delivering care in this kind of transactional way, as opposed to historically we were idealistic and thought it was relational, that you have relationships. And it sounds like you still do with your patients.
Well, yes, but, every Tuesday afternoon, I line up a couple hours, 3 hours or so of telemed, and, and it's mostly kids with acne that are on Accutane, and they need a monthly check-in. It's
Mm,
very transactional.
right.
Again, I don't make it transactional with them, but my point is there's a convenience factor to telehealth that we mustn't forget about, and I never
Hmm.
wanna malign that. I mean, that's the reason that Roe and Hims and others are successful is because we as traditional healthcare providers didn't offer those services. People would much rather go to their doctor than go to a website. But we're like saying, well, you can see me in 9 months. So I just want to make sure that we don't malign those people for offering a service that consumers want that we don't provide. The other thing I'll say I want to be careful about is giving, and I don't know that we never got to talk about the demographics of your listener base, but to give people the impression that everyone's corrupt in healthcare, because I work at a place where I think 99.9% of those of us that deliver care on the front lines are not. And we're not part of that some big awful machine and on the take and this and that. And I don't mean to single out the Mass General Hospital and Mass General Brigham system at all. It is a fine place to work, but I'm just saying that I think most people, when they go to their doctor, for the most part, are getting someone who wants to put their health first. So
Absolutely.
I wanna make sure that we don't leave people with the impression they can't trust healthcare delivery. Yeah, with that said, yeah, when you get these big corporate interests involved, and you're right, I mean, the pill pack and Amazon and, uh, One Medical, all that, it gives someone a little pause for thought for sure.
What do you think of the trend of private equity firms buying up
Oh, dear.
and managing primary care? Like, where do you think
Yeah,
that's
well, they're not I thought yeah, I know that less well, but in dermatology, it's, I guess I'll use the term a disease. Again, I wanna be careful, but again, for any listeners who don't know the way private equity firms operate is they roll up, package up, and cut costs and then sell. That's kinda what they do, right? Um, and I'm not here to malign anyone for making a living. I'm not, I promise. It's not to say that they're evil in doing that. It's just to my point earlier in the conversation when you're talking about people's health or their lives, gives me the willies a little bit. And dermatology is very popular with private equity. There's a lot of private equity out there. And of
Oh,
course,
really?
they're putting physicians' assistants and nurse practitioners on the front lines. And I don't know where it's going to go. It makes me uneasy. The other thing that the American Academy of Dermatology has a number of things going on with respect to AI, but one of them is pondering our future where we're compared to a physician extender with an AI backup, compared to a trained dermatologist. It's complicated. I'm not here to say that all of that is wrong, but it's
Mhm,
complicated. And so private equity just about always worries me when I hear it's involved. And
mhm.
again, it's not because I don't begrudge them making a living, but I don't know, buy up Kmart's or something like that. Don't come after healthcare practices.
Yeah, and for those of you who don't know this in a practical terms or hasn't, come across your radar, think about veterinarians because private equity got a jump on veterinarians and veterinarian costs and bills and upcharges and extra things have skyrocketed. And, these country vets where I grew up in Oklahoma, dying breed, and all of these roll ups that, Dr. Kvedar, you just mentioned are happening in that world. And to the end user or to the consumer, the patient, the dog parent, the cat parent, they pay more for the same service once this whole shenanigans is done. And I appreciate that you're trying not to malign people, but there can be this profit motive over care that can tip the balance, and there's really no policing to say otherwise. You buyer beware kind of thing. Like on the patient side, you have to kind of know what you're getting into. But a lot of people have never heard of private equity. They've never heard of all
Exactly.
these things. They don't know what's under the hood at all.
Well, I was once on the board of a private equity owned firm in the I'm trying to remember the name of the industry where people have those pendants that if you want to call 911, it's easy to do that. I just don't remember what that's called anymore.
Alert,
But anyway,
like a first alert system.
yeah, yeah, first
Yeah,
alert, that sort of thing. So I got to see it from the boardroom of a owned company how they work and it gives one pause for thought. I'll just leave it at that.
it was fun.
Yeah, it was fun to learn.
Yeah,
So much of what they did was based on this notion, and I see this in myself, I bet you do, and probably most of our listeners do, where you buy something that has a subscription and then you kind of forget about it. You keep paying the subscription.
hmm
I don't know. We should be thinking about ways to make money that are a little more fulfilling, maybe.
hmm yeah. So as we look at the world of health. So on this podcast, we're focused on empowerment. We're focused on helping people navigate around their brain and especially the habenula, which causes us to not want to try or not feel helpless, feel powerless. I do feel powerless when it comes as a patient, when it comes to engaging in healthcare. A perfect example, I went to Kaiser because a year ago, um, you know, walked uphill my horse. I was walking her uphill in street boots and I irritated my Achilles tendon. And then I got this incredibly painful bursitis, couldn't walk for a while, had to be in a wheelchair at the airport, all the things. And then it got kind of better just by resting it, and I didn't like that because I couldn't exercise, and anyway, I exacerbated it again about a month ago. And on a Wednesday afternoon, I'm at work, I've got back-to-back calls, and I was in town, so I decided, "Okay, I'm gonna drop by urgent care, Kaiser, blah, blah." I wait for I go in and I get my blood pressure, my pulse ox done, and then she says, oh, well, now you've got to go out there, and our next appointment for urgent care is in 2.5 hours or 3 hours. I have my laptop on me, so I'm doing computer work. I'm on calls. I'm okay in terms of that, but didn't want to spend my time in a waiting room with a bunch of sick people. And then I go in finally, and there's a nurse practitioner who says, "Well, we can't do anything for you. I can give you a steroid shot in your butt, but I can't inject into the joint or into the tendon. You'd have to get on a list and go, to orthopod for that."
Yeah.
So, so what that does to my brain is it tells me it is not worth my effort to try to get care,
Mhm.
and it raises the threshold of urgency, emergency in my subconscious, where I will not pursue care
Yep.
for something that I think is important, but that I kind of know now how allergic the system is to my seeking of care, you
Yeah.
know? And that's just one example, but there's so many ways in which the system is radiating this kind of go away
Mm.
energy,
Yep.
if I could call it that,
Yep.
and people getting caught up. So does some of the things that you're talking about in digital health, does it help with empowerment? Does it help with, you know, maybe encouraging people to be healthy and get care when they need it? Or is it all kind of like only on one side, when you're well and you're able to function, it'll help you in a convenient way on telemedicine, but then when you're really or if you're dying, you can go in the hospital or you've got something really, but in between there's really not much right now.
It makes me sad to hear your story. I part of the reason I still practice, again, I'm gonna be 70 next year, so I enjoy working and so forth, but there's also a sort of, uh, I I feel like it's a duty I have to people, to
Mm,
continue to do what I do because I am like an old timer. For my little world, which is not scalable, I know, but for my little world, I don't let that happen as best I can, and that's why I tell everyone, "Contact me," and this and that, um and I think about those things, and I think about them when because I'm gonna be 70, I get more touches to the healthcare system now than I used to too.
mhm.
So I think about those things when I'm in the patient chair as well. I don't have a good answer for that. The underlying problem, which I'll just say it, is we don't have enough. If we insist that and for certain things, like an Achilles tendon injury, you really telemedicine probably doesn't cut it, right? You gotta
Yeah.
be in. So, for those things where it's required that 2 people meet in a physical location to get healthcare done, we don't have enough healthcare practitioners to do all that stuff, which is why your experience. We just don't.
You're making me reflect on just my own attitude because another layer of my psychology there was that, hey, I know as a public health physician, I know to not overutilize. Like I'm in it for the group. I want everybody to have care, and so if I overconsume or I'm selfish or whatever, like and so I sort of self treated for a whole year and a half with this injury, not seeking care. And then I finally was like, you know what? I really have to get some help here. I'm kind of, it's going to keep happening otherwise. I think about for those of you who don't know, when you have an injury like that and there's inflammation, you can get scar tissue in there and then that can, potentiate more and more and more of this in that spot. So I was trying to, and I thought I was so virtuous by not going in the first time and not putting this on anybody's bill and not charging anybody, not incurring costs and things like that. So mindful. And so it was especially a slap in the face when I couldn't get even the simplest help, from all of that and all the premiums that I pay.
All those companies we talked about, Roe, Hims, Hers, I used to be on a board committee for Nurex, they've been acquired and but they did some wonderful work with, like, PrEP and birth control, and all those things are now you can get you can certainly get your acne taken care of by 20 different companies with a so that's empowering.
Mhm.
That sector is empowering. Our
Mhm.
sector of traditional healthcare delivery, especially when you must go in, is broken. But the digital part's doing pretty well, I think. It's just that not everything can be done digital.
Yeah, no, I think this is a really fair point. Like, what I'm hearing you say is that for those things that can be cordoned off, that are non-emergent, and that can be, cared
Transactional.
for just as easily in this more convenient way, that's actually more efficient. It's actually better for the patient. It's actually better for the practicing clinicians as well. But there's this other lane, if you will, that still has the old model that maybe hasn't been digitized or do you think AI is gonna touch that area in a better way, or you think it's still gonna sort of stay as a laggard?
Well, again, getting back to orthopedists, because that's just a good use case for all this. It's hard for me to imagine that you could get even 5 generations down of ChatGPT to give you the right thing to do without a physical exam.
Yeah.
It I just get that my brain I can't wrap my brain around that.
I think that's very astute because, there's so many people afraid of AI right now, and I think the solace that I would give people is we have flesh, we have, 5 senses, we have emotions, like, those are the things that really bring life to life. Even animals have those things. They have 5 senses, they have, emotions, and so, and they have language. So it's not enough just to corner the market on language to replace us, right? And that's why I think I'm a humanist in that way, that these tools will be ultimately, unless there is a maniacal human using them against other humans. Now that's a whole other sort of dark thing. We won't go there, but if it's just about the technology, interfacing with us and hurting us by its own intention, I don't see that that's a problem long term or replacing us.
Yep, couldn't agree more.
Yeah, yeah. So then going back to when you and when I was kind of at the cusp of my, I would say, awakening. I'll put that in air quotes because it's not like a spiritual awakening, but it's more like an intellectual awakening of having been in this more traditional healthcare and wearables and tech, right? Digital health. I did text-based programs for diabetes. I did, mindfulness-based programs online. I did wearables, tests, and all these things, right? Childhood obesity programs, all that kind of stuff. So I came from that background of intervention designs in healthcare for populations, for population health. And you and I had a conversation in Boston. I don't know if you remember this, but we had tea. I had tea. You might have had tea or coffee. I don't know.
Yeah.
And I was telling you that in my research on people who changed their health and, did it long term, that against all odds, against all social determinants of health, if folks know what that is, just basically disparities in health, that I was noticing that they had this very different approach. The people who succeeded lifelong to change themselves,
Mhm.
and their superpower was to iterate and to practice and iterate and practice and iterate like you would a skill or a sport or a musical instrument or any other thing in endeavor where you're building skill. And that was very different than the SMART goals, the tracking of wearables, all that kind of stuff. And so I was scared to tell you that. I remember that. I remember being nervous because I didn't know whether I could articulate it clearly enough and whether you would cognitively flex, which you did, obviously, otherwise you wouldn't be here. Um, you would cognitively flex to a new reality, a new paradigm, and you instantly got it. So I'm just curious, what was it that you saw in that work that maybe you had seen other patterns that it gave you a sense of grounding, that this is natural or that this is something found in nature?
Well, thanks for the question, and you're right, I did get it immediately, and I do remember the discussion. I would start by I mentioned earlier that I had been enamored of wearables as early as 2008, and we had but prior to Fitbit, we had these coin-shaped things that we stuck on our shoes that measured steps, and at that time, Bluetooth was terrible, so, again, we overcame a lot of tech, but what I learned early on with that whole thing was, gee, if I can track a number, it gives me so much insight about my behavior. At that time, I had no idea how inactive I was. And I started looking at these numbers. I'm like, God, I did nothing today. So another very quick, and I will move on, but I used to in the fall have to rake my yard, and I was annoyed because I'd rather be out cycling. And I had this thing that I was measuring calories, and it turned out that I burned more calories raking my yard, so all of a sudden that became exercise. So those insights to me were foundational, and I thought, "Oh, we've got to figure it out. That's all we need to do is give all our patients with chronic illness these gizmos, and their behavior will change like mine did." And of course, that sounds so silly and naive now because what I learned was motivation is the key. Right, it's not just the number. Some people don't give a darn about numbers, they could care less. I happen to be motivated by that sort of thing, but I'm a small slice of the population, and we learned that. And if you recall the Connected Health conference, you mentioned that almost every year we had 1 or 2 people that was doing something on motivation.
Mm,
We had your, mentor, BJ Fogg, one year, we had Charles, I'm trying Duhigg, remember that book, about habit formation? We had so many interesting people speak because that was something that was interesting to me. Um, so it was in my mind, and then you just kinda laid it out, and I'm like, well, that now became obvious after you taught me about it, and that's why I was in immediately.
that's amazing. Yeah. And so, what is well, two final questions. One is when you were departing from the conventional thinking and people thought you were nuts, for going in this direction.
Yes.
What would you say as advice to those of us who are departing from the conventional wisdom and living creatively and kind of calling balls and strikes, because I think that's the people who want to be unstoppable.
Yeah.
Part of the stoppability of being a human is peer pressure or feeling lonely or feeling like you don't belong to a particular group. So what helped you get through that time, and what would you recommend for others to do who are departing from the norm?
Well, what helped me probably isn't scalable, but it's remember I said there were 2 or 3 things, and I shared one already, so I'll share another one, which was I grew up in a household in Central Vermont, and my folks were both high school graduates, just really plain people,
Mm.
salt of the earth, loving and all that, but, like, when they said something, it was you knew what they were talking about, there wasn't any innuendo, there wasn't any politics, nothing. So I carried that naivete into the business world, and when I was out pitching what we call telehealth then, people would politely meet with me and not much would happen, but I didn't hear that last part. So unless they said, "Get out of here," bluntly, because that's what my dad would have said if he wanted me to get out, I just kept coming back for more meetings. And that really helped in the beginning to not get discouraged because it was a blind spot that was just really helpful to me. Um So, again, is that transferable? I'm not sure, but the lesson learned, and so many people will say this about entrepreneurship in general, which is, and if you ever watch Shark Tank, right? The ones that don't get a deal with a shark come out and they say, I learned a lot, but I'm moving forward. And you kind of have to have that. Like, on the one hand, you have to listen to the market. You can't be so blind that you don't listen to the market. But on the other hand, you have to have the confidence. I just always knew this was going to happen. I didn't know it'd take 30 years. I'll be honest about that. That's the 3rd time I've said it. But I knew this was gonna happen. So, it was that kinda thing where there was no world I could envision that this wasn't gonna happen, and therefore, when people didn't say to me, "I don't want to meet you again," I just kept coming back, and eventually things started to happen because they saw me as, uh, one guy said, "quietly enthusiastic," or something like that. I don't remember the term, but so I think that's helpful. I think, the other thing, I had the luxury of being in academia. Again, if I took investor money in 1994 or 5 to try to envision one of my dreams, I would have failed, and I might be working. I don't know what I'd be doing. I'll probably be seeing patients without any of this stuff. So
Mm,
that's a place where you can screw around a lot, and as long as you're doing stuff that meets academic standards and you're publishing papers and whatnot, you can do more cutting edge work.
that's
Um,
awesome.
so those are just a couple of thoughts. It's a hard question, I think.
It is. It is. It's hard to, give advice from our past selves to the future, you know, people that you don't know and just, give wisdom. But I think it's worth mining for in your case because this is all about patterns of how you got here. And so on that note, what is your one prediction of where digital health is going to go that you see? Because you're a trend spotter, you're an innovation spotter with your vision that you think other people don't see, and you don't have to say when it will happen, but what do you see that's unique that you wish other people could see? Or
So again, I would never put myself out as seeing something that others don't see because I just don't know what that is, right? But I will say the answer to the question, I think, and believe me, I'm not the only one that sees this, but I think there's enormous potential for digital twins. And we're just starting to get a grip on what that might look like. Again, it's something that, and part of the Internet of Healthy Things, although I don't think in that book we ever used the term digital twin, that's what we were talking about. Um, and now you're seeing that come into play in so many ways. The way I like to say it is envision that you could be your own control group for an experiment. You create a digital version of yourself, and then you apply that, whatever the intervention is, to that digital version, and you can see how that's going to turn out. We're getting to the point where we can have an exact enough copy of you to do that. And there are many others like, well, I respond to this medication. I mean, now I don't know how much of my clinical life is, I don't know. Well, you have rosacea. Let's try this because we have four things we could try. And, three of the three, maybe a third of those people come back because now first one didn't work. What if we could use your digital twin to say, oh, how are you going to respond to this therapy? Let's just plug it in and see. So I have enormous excitement about that technology.
that's awesome. Well, with that, we will thank you so much, Dr. Joe Kvedar, for being with us, and really appreciate all the wisdom that you've imparted today.
Oh, please, it's been a pleasure. It's always a pleasure chatting with you, and now we get to do it in public.
Yay!